So you want to know about the PSA test for prostate cancer and why the evidence says no, but doctors say yes. Well, in this video, we're going to teach you all about the PSA test and why it's a very bad test and fails to save significant numbers of lives. Welcome to Health Drum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. If this is your first time to the channel and you want to learn all about good health, then go ahead and subscribe below. Like you, many are also interested in digital health, so feel free to reach out with an email or hit the comments section below. Health Drum is for educational and informational purposes only and not a substitute for professional medical advice. The links to this disclaimer and the material in this video are in the description below. So let's get into it with a summary of what this video is all about. So in this video, we will talk about what a patient expects when they visit a doctor. Then we'll talk about medical truths. We will discuss the fact that healthcare is financially driven, and we'll examine the many PSA test flaws, and we will discover that PSA testing fails to save significant numbers of lives, yet the medical community still promotes PSA testing. So what are your expectations when you make a doctor's visit? So naturally, anyone who sees a doctor expects brutal honesty, evidence-based support for testing and treatment recommendations, that their care is given to them to the best of the practitioner's ability, in your best interests, and allows a quick return to normal daily activities. Clearly, anybody seeing a doctor expects trustworthy recommendations. However, there are a number of very uncomfortable truths in medical care, and we're going to go over some of them right now. That only 11% of all medical treatments are of known benefit is an absolute shocker, and this means that most medical treatments may be of benefit or of no benefit. Yet, most accepted medical tests and treatments are labeled as FDA approved, standard of care, included in medical guidelines, and in widespread use. The fact that there is so much regulatory support for unproven treatments is of great concern. So how is this possible? How is it possible that only 11% of all medical treatments are of known benefit? It's important to realize that healthcare is financially driven and full of financial conflicts of interest. Therefore, it's plagued with exaggerations, misrepresentations, and scare tactics, and commonly employs the shock value of a cancer label. Patients are commonly overwhelmed with medical information and often fail to understand the medical language or the details. This leads to patient confusion and doubt, and the scenario makes most patients very vulnerable to desperation and manipulation. So why do doctors continue to promote the PSA test, but the evidence shows that the PSA test is severely flawed? Let's check the next screenshot. So the PSA, or prostate-specific antigen, was FDA approved as a screening test in 1994, knowing full well that this test was highly unreliable and failed to meet the criteria for being a useful screening test. The PSA test has a false positive rate of over 78%. The specific label is a barefaced lie, as it is neither specific for the prostate or prostate cancer. Its levels of 0 to 4 as being normal are a complete fabrication and meaningless. Big prostates usually generate big PSAs, and the 10 to 15% of potentially deadly high-grade prostate cancers often make little or no PSA, so PSA testing for these important cancers commonly fails. The test is an overall disaster, and you can check the links in the description below to validate what we're talking about. So the PSA test is highly unreliable, but invariably an elevated PSA test leads to an equally unreliable and very risky prostate needle biopsy. Let's check the next screenshot. So there are different ways of doing this prostate needle biopsy, but commonly it's the transrectal approach with an ultrasound probe placed in the rectum and the needle guided into the prostate. Usually 12 needle cores are taken in a random and blind manner, resulting in about 0.1% of the prostate being sampled. In other words, 99.9% of the prostate is unsampled, and therefore we have no knowledge of what's going on in the majority of the prostate. Not only is this test highly unreliable because of gross sampling errors, but there is also a great risk of septicemia. So the available scientific evidence says that the PSA test is highly unreliable, but does it save lives? Urologists' own studies have determined some years ago that PSA testing for prostate cancer fails to save significant numbers of lives. In part, the result was due to the fact that the PSA test was highly unreliable and that most prostate cancers are not a danger to health. So what did physicians do when they knew that the PSA test was highly unreliable and failed to save significant numbers of lives? Let's check the next screenshot. So physicians knew that the PSA test for prostate cancer was a disaster. However, despite that knowledge, the PSA test continues to be FDA approved, included in medical guidelines, labeled as standard of care, and remains in widespread use. This failure by physicians and healthcare oversight agencies to recognize that this PSA test is a disaster makes a mockery of informed consent and shared decision-making. Instead, this PSA testing leads countless men to overtreatment and great harm without any benefits. Let's move on with an image that summarizes the many flaws with the PSA test. It's simply outrageous that the evidence about the PSA testing says no, but that physicians and regulatory health agencies continue to say yes. So let's look at some issues about what happens to patients when the evidence says no, but physicians continue to say yes. So surprise, surprise, when the medical evidence says no, but physicians say yes, there's often a background of financial conflicts of interest. Money-making interests commonly ignore potential harms, costs to patients, complications, time away from work, and breaking trust. When it impacts many patients, as it does in the prostate cancer arena, it's an absolute public health disaster. All of this information about the lack of benefits for PSA testing has been known by physicians for years, but the PSA test keeps being recommended. Clearly, a treatment or therapy is not unproven because it failed to receive full regulatory approval. It can get full regulatory support like the PSA did and still be a total failure. So what should physicians and the regulatory health agencies do knowing that the PSA test is a total fraud? We need to stop the hoax of PSA screening and injuring countless men. Physicians and the healthcare regulatory oversight agencies need to rescind the FDA approval, remove the PSA test from prostate cancer guidelines, and the insurance industry needs to stop payments for the PSA test. By ignoring problems with the PSA test, we have simply allowed a public health disaster. The PSA is highly unreliable and fails to save significant numbers of lives. Just because there's no alternative blood or urine marker doesn't mean we should continue with this highly flawed marker. So let's recap. In this video, you learned that the PSA test for prostate cancer is highly unreliable, invariably leads to risky biopsies, fails to save significant numbers of lives, and harms countless men. To learn more about other routine medical conditions, self-care, and digital health, check out these other videos.